Hey guys, my name is Dr. John Jazeri coming to you from San Clemente, California. And in today's video, I'm going to be describing to you if you should get 2 implants for your overdenture treatment or if you should get 4 implants for your overdenture treatment. Okay, so what is the criteria? What are the criteria you need to consider when deciding if you should go with 2 implants or if you should go with 4 implants in order to secure denture in place? All right, these are referred to as Snap-on dentures, overdentures, or implant retained dentures. But the question we're going to be discussing today is how many implants should you get, 2 or 4? And what I'm going to do is I'm going to go over the 5 criteria which you need to take into consideration when making this important decision, okay? The first one is going to be the size of your jaw. The second one is going to be your gag reflex. The third one is going to be the condition of your opposing arch. The fourth one is going to be your long-term plan. And the last one, and the most important one, of course, is going to be your budget. But of course, you want to understand everything before you decide which option is the better option for you. 2 implants or 4 implants. And by the end of this video, you'll have a clear understanding of which option is the best for your mouth and for your needs. You know, the problem is a lot of times where dentists are doing this, they might not give you a very clear explanation. Even in my own practice, I have a very hard time relaying to patients what's the difference between 4 and 2. I mean, I know what's the better option for each patient, but what do I look at to make this decision for each patient? And of course, you know, the number of implants you put in is going to determine how much your treatment is going to cost. So is it worth spending a couple extra $1,000 for the additional 2 implants to get 4? Or should you just go with the least amount of number of implants and just settle for 2? And at the end of this video, you'll know exactly which one is a better option. Now guys, if you have any questions, please leave them in the comment below. I'll be glad to answer them. And before I get this video started, I want to bring the attention of those of you who are looking for a dentist but don't currently have one to go check out the website even28.com. That's EVEN, the number 2, the number 8.com, like the 28 teeth in your mouth. Even28 is a dentist search engine. You can browse through profiles of local dentists to find a great dentist next to you. You can schedule your appointment online, all conveniently for free from the website even28.com. So guys, check out the video and check out the website to find a great dentist. And I hope you enjoyed the video. I'll see you guys soon. Guys, the first factor that you should consider when deciding how many implants you need, whether it's 2 or 4, is the size of your jaw. The bigger your jaw size, okay, whether it's the top or the bottom, the bigger your denture is going to be and the less support you're going to get from each individual implant. Okay, so what am I trying to explain? Basically, if you have a big mouth, you need more implants, all right? This is what an average size denture would look like, okay? So just for comparison purposes, you know, this is about average size, right? If you have a very big jaw, okay, so if your bottom denture, instead of this, goes all the way up to here, or if your upper denture is just massive and much bigger than this, then you're going to need more implants because the support you get from each individual implant is only so much. Let me give you another illustration to make better sense of this. This patient presented to me, okay, and you can kind of see on this x-ray, this will help you all make sense of it, with 2 implants and a lower denture that went from here to here. Her jaw was huge. And this is usually a problem I see more commonly in males, but it can also happen in females. So you have this massive denture, which was maybe like 4 or 5 inches long, and these tiny 2 implants. So do you think the implants will support the dentures? Of course not. They were not able to support the denture, and the denture was pretty loose. So what we ended up having to do is we ended up putting 2 extra implants on site. And now the size of the implant and then the denture and the number of implants start to correlate better with each other. So it started to make sense. And it actually ended up making a huge difference. Those 2 implants ended up holding the denture in place very securely, and the patient was able to function really well. So yeah, if you have a big jaw, big arch, your dentures are big, you already know who I'm talking about, okay? You might be a big guy or you might be a lady with a bigger jaw. But if your dentures are really big, Can two implants support them? Well, you might be able to figure it out just by looking at the size of the denture and kind of determining if those additional two implants are going to actually play a role. Now, of course, the opposite also goes in effect. If you're a little old grandma with just really tiny arches, tiny little mouth, everything is shrunken up, then yeah, two implants is going to definitely get the trick done. Don't waste your money on the additional two implants to make it four. Okay, just stick with the two. But yeah, the size arch is one of the main determining factors. So when I look at a patient, I look at how big their jaw is. If they have an existing denture, which they're trying to convert or trying to replace, I look at that to see how big it is. And based on that, we can make a decision of, okay, you have a really big jaw, 4 implants is going to serve you better, or no, your jaw size is small, 2 implants is better. So that's the first criteria you should consider when deciding how many implants you should put for overdenture treatment. The second factor you should consider when deciding if you should get 2 or 4 implants for your overdenture is your gag reflex, or basically how much pink gum tissue you want to be scraped off of your existing denture. Okay, so let's go back to our models that I was previously kind of using here. This would be the upper, this would be the lower, okay? Let's start with the upper. So the upper denture covers the roof of the mouth, right? It goes as such, and it's the roof of the mouth that gives it support. If you decide to put 2 implants, great, your upper denture is going to be tighter. Can you get rid of this part? You cannot. With 2 implants, you get plenty of support from the implants, but a vast majority of the stability of the denture does still come from the palate coverage, this part right here, which is the palate. So with 2 implants, if it was to play 2 implants here, I would still need most of the palate. Yeah, I might be able to cut a little bit, but I cannot cut your dentures and get rid of all of that. If you wanted to do that, you have to get 4 implants. So if you want to get 4 implants, then what I can do for you is I can cut all of that out. I can get rid of all of that. I can even start getting rid of some of the exterior portion of it and just make it smaller. So I can make you a very itty bitty denture if you get 4 implants. If you get 2, I can't. Your denture is going to be almost the same size with 2 implants versus no implants, because the stability you get from 2 implants is good, but not great. Whereas the stability you get from 4 implants is fantastic. So for the upper denture, if your plan is to get rid of the palate so you can taste your food better and speak better, you got to go with 4 implants. On the bottom, okay? On the bottom, with 2 implants, there's still going to be some movement from the tongue and whatnot. With 4 implants, it's extremely stable. So when patients opt to get 4 implants, as is the case here on our model, again, same concept. We can get rid of the gum tissue here, make it much smaller, and the same on the outside. I can get rid of a lot more of the gum tissue, so it's not digging into your cheeks and your tongue side, okay? Whereas with 2 implants, yes, the denture is going to be more stable, but you can't cut the pink and make it much smaller. You still need the acrylic portion, the resin portion, in order to stabilize the denture in the mouth. So if your plan is to get a much smaller denture, then yeah, you got to go with 4 implants. But if you're okay with a bigger denture, you just want it to be stable and not rock, then 2 implant gets the job done. So that's what you need to decide. Patients who have a gag reflex on the top or who want to taste their mouth and have no palate, they got to go with 4 implants. Okay, for the bottom denture tends to be more mobile, so a lot of people get implants for the bottom as compared to the upper. Okay, with 2 implants, it'll be stable, but again, all of this pink, all of this resin portion needs to remain intact for 2 implants. If you want it to be really tiny and not go as deep into the gum tissue, you gotta go with 4 implants. So with 4 implants, you can have less pink. With 2 implants, you really can. And that's one of the determining factors of whether or not you should do 4 or 2. It's how much gag reflex, how much tolerance you have for the pink acrylic portion of the denture. The third criteria, number 3, you need to consider when deciding on whether or not you should get 2 or 4 implants for your overdenture is your opposing arch. Okay, what does that mean? I'm going to use an X-ray to explain this better for you. Okay, so this patient has almost all of his lower teeth, but nothing on the top, okay? Or you can have the vice versa scenario. You can have all of your upper teeth, nothing on the bottom, okay? So when you have natural teeth opposing dentures, as is the case here, right? Natural teeth opposing dentures, you want to go with 4 implants, no questions. Because what happens is natural teeth have a lot of forces, Okay, so when you have natural teeth on the top or bottom and you have complete dentures on the opposite side, two implants is not going to really get the trick done. The dentures are going to keep moving, they're going to keep falling out, you're going to keep breaking them, and it's just not going to give you the results that you want with only two implants. So if you're going to do the investment to get implants in this particular case, always go with four, because natural teeth versus dentures creates a lot of stresses which the denture cannot handle. Now, if you have no teeth on either arch, this is not something to worry about. Tube is going to be probably sufficient. You might want to look at the other criteria. But if you're one of those people who've lost all of their teeth in one arch and none of their teeth, or maybe one or two in the opposite arch, which does happen, as you saw in this x-ray, and I've seen it happen in my practice. It is usually common to lose all of your teeth at once, because a lot of times gum disease affects upper and lower teeth equally, but there are cases where the patient start off with some failing crowns and bridges, or the gum disease affected one arch. So yeah, if you fall into that category, natural teeth opposing dentures, you always want to consider paying for those extra 4 implants. In fact, I would encourage you to look into options of permanent teeth, but if all you can afford is over dentures, snap-on dentures, 4 is going to be the way to go, 4 dental implants. So that's the third thing to take into consideration, is the condition of the opposite arch. The fourth thing to take into consideration when deciding between 2 or 4 implants, guys, is your long-term plan. Okay, here's what happens. Let's say you go and decide to do 2 implants, 1, 2, and get an overdenture with 2 connectors on it. 1, 2, great. You went with the less expensive option, and you're probably going to be happy with your denture at the beginning. But what happens is, over time, these dentures tend to get loose. Why? Because you only have 1 implant on each side supporting it. And what happens is, I'll tell you guys what you need to consider. There's these things inside of these dentures, okay? So if you look at this connector, and again, this is a model, there's something in there called an O-ring, which helps hold it in place. All right, so this would be an example of an O-ring. That's the blue one, and they usually come color-coded. And that's the pink one. Okay, so what these O-rings do, they're kind of a replaceable plastic part which gets seated in here and helps with the suction forces to hold them in place. Luckily, the O-rings can be switched out. It's kind of like maintenance, like imagine putting new tires on your car. So yeah, that is one of the things that you need to consider. Are you going to be able to go every year or so to have your O-ring replaced? Because yes, with 2 implants, the denture gets looser at a much faster rate. If you have 4 implants, because there's 2 supports on each side, if one of the dentures connectors starts to get a little bit weaker and looser over time, you still have 3 implants holding them in place. So the difference becomes very negligible, and usually you won't notice it. So people who end up getting 4 implants do not really need to maintain their dentures, maybe ever, or maybe for 5-7 years. Whereas people who get 2 implants usually have to go back to their dentist on an annual 6 months, 2-year basis, but they need to see their dentist on a frequent basis to have these O-rings replaced and have the denture tightened over and over again, because the denture tends to lose its stability and traction. And the way you feel with your denture when you leave on the same day, couple months later, it's going to be a lot looser. So if you're okay with that and you'd rather save the money at the time of doing the treatment, but keep going for maintenance over time, understanding that they will loosen up and need maintenance, then go with 2 implants. But if you just don't want to deal with the dentist and want to get your dental implants and never see the dentist again, then 4 is the better way to go. But yeah, in terms of a long-term option, with 2 implants, there is some maintenance required. With 4 implants, there's almost none. So that's the 4th thing you need to take into consideration, guys, when deciding between 2 or 4 implants for your Snap-on dentures. The last thing, number 5, what you need to discuss and consider before going for your option of 2 or 4 implants is your budget. Now, why am I discussing this at the end where it's probably the most important one? Because it really shouldn't be, okay? We went over 4 things already. Your jaw size. You have a really big jaw, 2 implants isn't going to be sufficient. Your gag reflex. If you gag a lot and you're planning on using implants to get rid of your gag reflex, 2 is not going to be enough. Opposing arch. If you have natural teeth and dentures, 2 is not going to be enough. And long-term maintenance. You know, if you're doing this for your mom who's in a nursing home, is very fragile and they cannot go back and forth to the dentist, 2 is going to get looser, so you might as well invest in 4. Okay, so once you understand those things, it really makes sense, and therefore the budget comes secondary. Because If none of those things really apply to you, then yeah, just go with 2 implants. Save the extra money, go on a vacation, have fun, whatever you want to do in it. Invest in the stock market. But if one of those things that I mentioned applies to you, then you might as well go with the 4 implants, because what happens is the extra money you're going to spend is going to really benefit your mouth. And the question is, can you convert 2 into 4? Yeah, sure, you can do it. But it's a lot of headaches. You have to drill 2 more implants. You have to wait for them to heal. You have to put the connectors. You have to do the conversion. So, as your dentist, if you want to do 4 or 2, I would much prefer for you to make that decision up front. Otherwise, you're going to be spending countless months with me to add the 2 implants and do the conversion. And financially, I can give you a much better price if you tell me right up front to do 4, whereas if you want to do the conversion later on, you might even need a new denture, which is going to add a lot to your expenses, So you want to make this decision the right way, and of course the budget is an important factor. But the reason I put the budget at the end is a lot of times when you've made the decision to do this, your dentist will work with you. So if there's reasons for you to do 4 implants and it's an absolute must in your case, the difference between 4 implants and 2 implants is usually, in the United States, a couple $1,000. You can finance it. You can come up with ways to make it work with your dentist. If you have a cooler dentist, they might give you a slight break on the additional implants. I don't necessarily charge people twice as much for 4 implants versus 2. Now, of course, I have my costs when it comes for implants, right? For each extra implant, you have to get the screw. You have to get the connector. And then you have to get these parts that are going to connect to them, these O-rings and whatnot. And then the male-female part that goes into the denture. So there's a lot of parts. I have a lot of expenses for each additional implant. But if you're going to get 4 implants and you know that, you can get a better price if you negotiate that upfront with your dentist. Where as opposed to, a lot of people who get 2 implants and now decide they want 2 more, a lot of times they have to find a new dentist or pay for the entire treatment with a new denture. Ends up costing a lot more headaches, a lot more money. So while budget is important, I don't want you guys to make that decision based on this budget alone. I want you to make it based on what's better for your mouth. And if you really need 4 implants because your jaw is gigantic or you have a huge gag reflex, then just save up more money and get your 4 implants later. But try to make the right decision the first time, because this isn't easy. These conversions of dentures and these implant placement takes months and tons of visits, a lot of stress on your body, needles and whatnot. So make the decision, go with the right option, but of course the budget is important, but it should not be your priority by any means. So anyways, the 5th thing to consider is your budget, guys, because 4 implants does cost more than 2 implants. Guys, it's time for my final thoughts to share with you my personal opinions of 2 versus 4 implants. 2 implants for overdentures or 4 implants? Which one's better? 4 is always greater than 2. Not necessarily. I went over everything you need to consider when deciding how many implants you should get. So, and as I mentioned, while the budget is important, you want to make your decision based on what's going to give you the best results, because sometimes 2 implants is sufficient and sometimes 2 implants is completely useless. Sometimes overdentures isn't going to do it. You need to do permanent teeth. So you really got to consider a lot of things and before you make this important decision. But at the end of the day, if you need 4 versus 2, you want to make that decision, talk to your dentist, try to come up with a dentist who's going to do the work, come up with a price that makes sense, and just stick with it and go with that route, because converting a 2 implant denture to a 4 implant denture is quite a bit of headache and nobody wants to do it. Your dentist doesn't want to do it and you don't want to do it. Having said that, what do I see mostly in my practice? I mostly do 2 implants, okay? Because 4 costs more money. So a lot of times 2 just gets the job done, and I do that. And if I see a reason to go with the 2 extra, then we discuss that with the patient and we go with that. As far as top or bottom, usually it's the bottom, right? Because the bottom denture is the looser one. So I usually do a lot more lower implants than I do upper. The upper, the suction factor, just the roof of the mouth, tends to hold the denture in place. Well, you would think it's the other way, right? You would think the gravity pulls it down. No, the suction of the upper helps a lot. So the people who usually get implants on the top are the ones with gag reflex. And a lot of times when they decide to do that, they're like, I don't want the palate Well, guess what? 4 implants it's gonna be. For the bottom, you got a tiny little arch like this. 2 implants gets the job done. Just make sure when you get the 2 implants, they're not close to each other like I showed on that x-ray. You want them a little bit spaced out. And I'm gonna kind of discuss this really quickly before I wrap up my video here, guys. Okay. So yeah, when you're doing a scenario like this with the 2 implants, you don't want them this close. You want them a little bit further out. But don't forget, guys, there's a little nerve here, the incisal canal and the mental foramen. So you can only go so much further back. And again, the same situation with the upper. When you're placing these implants, there's a little sinus here. So these implants are always gonna be here. You know, a lot of times people get these overdenture implants thinking there's gonna be 2 here, 2 here. No, it doesn't work like that. You usually have lost so much sinus bone and your jawbone has dropped so far that it's close to your nerve. So the implants have to be focused in the front, which brings another reason. Some people who decide to get additional stability, they want those 2 extra implants, and they're always concentrated in the front. So overdenture implants are always considered in the front region, right under your nose and right above your chin. And that's just where your best bone is. You know, if you want implants in the back, you have to do some really crazy bone grafting, which almost nobody does. And at that point, we just add the 2 additional implants, make it 4 implants. You can even do 5, 6 implants and put them all in the front. Guys, I'm getting off topic here. I hope you enjoyed the video. Whether you're doing 2 or 4 implants, if you really want a question, feel free to just leave them in the comments below. I'll be glad to discuss them further to help you guide you in the right direction. But either way, just make sure you find a great dentist. Make sure you dedicate enough time to go there so you can get your implants and you can get the dentures. This is not an overnight process. It usually takes months. Yes, there's labs that do them overnight, but you know, it's a hit and miss still. You know, sometimes you do all the work, denture's just not a good fit, and you have to start over, make a brand new denture from scratch. Make sure you discuss all these things and you're just ready for every scenario. Do not rush your dentist. This is not, like I said, this is a marathon, not a sprint. And good luck with your treatment, and I'll see you guys on my next video.